You are dispatched to the house fire.
House fire.
Police and fire are on the scene. Multiple patients involved. It's a multi-unit apartment building. And you are the extra help. You are additional resources. And as you arrive, they bring you a patient who is currently in respiratory distress with various types of burns from head to toe.
All right.
Okay.
Okay, so we are going to approach the scene with our PPE.
Okay.
Is the scene safe for us to approach? You mentioned that there's fire and PD.
PD's on the scene.
Great. And at the moment, we only have one patient.
Okay.
Correct?
Yeah.
And yeah, I mean, we could call ALS. I'm sure there's other people on scene, but
Yeah, and then our mechanism of injury would be, let's look at burns. You said there was respiratory distress.
yeah, it's a house fire.
House fire.
Okay. Great. So we are going to try to get some general information from this patient. We're going to ask them their name and age.
Their name is Janice, and when they start talking, you hear Strider coming.
Okay.
From their airway.
Okay. So indicative of their upper airway swelling.
Yep.
All right, Janice, can you tell us where we are?
They say they think they're at home.
Does she know the day?
She thinks it's Monday, but it's Tuesday.
Okay. And does she know what just happened?
She says she was just watching TV in her bedroom and she saw smoke under the door and her living room was on fire and she went to go into the living room to find her cat, couldn't find the cat, and then got crushed by the building and then firefighters pulled her out.
Okay. So I don't think she's fully
She's
alert
not fully
and oriented.
Anno
Probably,
times 3?
yeah, I would say times 3. All right. So we are going to say she looks sick. So we're gonna start approaching our ABCs. So
wait, first, has she experienced any falls?
She was just crushed by.
Yeah, crushed.
Good catch.
Yeah, she was crushed. She says she didn't pass out or lose any consciousness, but you've deemed her to be confused.
Yeah.
Yeah.
So I think
Since she has AMS, altered mental status, let's do spine stabilization.
Yeah.
Okay.
So, yes, for C-spine.
Yes, for C-spine. We are going to lay her on, or we can have her take a seat on our stretcher. Or wait, how did we find her positioning? Was she...
The other firefighters wheeled her to you.
Okay.
Wheeled her? Okay.
So she's currently on a stretcher.
Okay, she's already on a stretcher.
Okay.
So we can apply a... oh my goodness, I'm blinking.
C-collar?
Yes, a C-collar.
Okay. Before or after a neck assessment?
After
a neck assessment.
Did we even do ABCs?
No,
not yet.
no, we didn't.
Okay.
Why don't we do that?
All right, so she's speaking to us. So we know the Airway's patent, but you said there was Strider, right? So we know that there's swelling.
Is there any bleeding?
Yeah, exsanguination.
There is bleeding.
No, there's not.
Oh,
Okay.
All right. So what is her tidal volume?
It is adequate.
Adequate tidal volume. Is her breathing pattern
Regular.
Regular, and her breathing rate?
Rapid.
Rapid breathing rate.
Okay.
Lung sounds?
Lung sounds are wheezes bilaterally, and you see singed nose hairs and soot around her mouth.
Okay, so signs of burns to the face.
Yep.
And what is her SpO2 at the moment?
89.
89.
And then is she using any accessory muscle use when breathing?
No.
Okay.
89. So wheezing, 89. Maybe you could do a nebulizer and we can attach like albuterol and Atrovent.
Okay.
That should help the wheezing and the Strider.
Yep.
Okay, so we are going to make up. I don't think we have the oxygen kit here, but we're gonna set up a neb kit, and we're gonna put 2.5 milligrams of albuterol and 0.5 of Atrovent.
Okay.
And those should help dry out the lungs and also, help the. Oh my goodness. what is it
Wheezing?
called? Yeah, I should have the wheezing. I'm trying to think of the anatomical name. But
Okay.
anyways,
And then we'll put it on, what, 15 liters per minute?
for a neb kit, yes.
Okay.
Yes. Or is it 6 liters per minute?
It's 6.
It's 6?
6 liters per
Okay.
6 liters per minute, neb kit, I'll do that. And I'll be raw. Great. So while you're setting that up,
Okay.
I can go ahead. Yeah, right. I can go ahead and continue with circulation. So you said there was no bleeding, but can we get skin conditions
Yeah.
or temperature, color, and moisture?
Pink, hot, and diaphoretic.
Pink, hot, diaphoretic.
And you notice a variety of different burns throughout.
Yeah.
Yep.
Okay, so should we start taking care of the burns or continue our
Are they life threats?
the burns?
Burns?
No. I mean, I guess we'll find
we're
out
going
if
through
they
the
are
life
life
threats,
threats.
right?
Yeah.
We're going through the
Okay.
life
Okay,
threats.
so let's
Alright.
continue this. So
Pulse
we got skin
rate.
conditions. Yeah.
What is this pulse rate or whole pulse rate?
It is rapid,
Okay. Rapid. What's the strength?
strong,
And then is it equal?
equal,
And then what's the pattern?
regular.
Regular? Okay. And then
Cap refill.
Cap refill.
Is that, yeah. Is the cap refill less than 2 seconds?
Yep.
Okay.
All right. So I will say she's in a state of shock. So we already have that oxygen going.
Fun fact: what type of shock is burn shock? And let's say she has peripheral edema.
And she has peripheral edema.
We had this discussion on compartment syndrome.
Yeah.
Circumferential burns. Like what happens to the fluid when someone is burned? Like, why do you think blisters form?
Right. So it's fluids leaving the circulatory system going out.
So yeah, what type of shock is that?
That's I can't remember the name now.
Starts
Hemos-
with a D.
It's distributive?
Yeah.
distributive shock.
Okay.
Nice.
It's just the fluid is
Oh
distributing.
yes.
Yeah.
Right.
I was just thinking
Anaphylaxis,
vasodilation. Yeah.
sepsis, burns.
Right. Okay.
All right. So we've determined that. What's the next one? The environment.
Yeah.
Yes.
So obviously she was in a house fire. She's now outside of that.
Any risk of hypothermia?
I mean, maybe
Maybe
hypo,
Maybe
hypothermia.
hypo?
not because of the environment, but more so because of her burns.
Right.
Okay.
Okay. And okay, yeah, I think now we can do the full body assessment. So we can start at the head, or actually yeah, go ahead.
Yeah, we can start at the head. So we are starting at the head assessment. We are looking at DCAP, BTLS.
Yeah.
So is there any deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling?
You notice swelling to the head and face,
Okay.
and you notice redness, like redness from the burns on her face. So it's like a sunburn.
Okay.
So on the head and face,
Like what else are we visualizing on the head and face?
Is there any bleeding?
No.
Is there any
Raccoon-
fluid
yeah.
coming out of the nose or ears, like cerebrospinal fluid?
No.
Okay.
any raccoon eyes?
What
or-
other fluids might be coming out, Nathan?
Blood.
Okay, and
In this case, the cerebrospinal fluid.
no, none of that is noted.
None of that is noted.
Okay, and then what you said something earlier?
Oh, I was saying raccoon eyes.
Okay,
or-
so raccoon eyes or
Battle signs.
all right, neither of those are noted.
And then the mouth.
What about the mouth?
Are there any missing teeth? Anything
Yeah.
coming out of the mouth?
Yeah, no.
No? Okay. And then,
And then how do we palpate?
palpate.
So no, not a lot of pressure, just gently grazing over the head to see if there's any bleeding on your gloves, or if you find any like deformities on the outer edge. Of
Okay.
the head.
So like back of the head, top of the head, forehead, cheekbones, upper lip, lower jaw. None of that is noted.
Okay.
Moving on.
Moving on to the neck.
Okay.
So decap, BTLS.
All right.
Is there any of that present?
No.
Bleeding?
Nope.
JVD or
JVD,
jugular
no
vein
JVD.
dissension.
What's it called? Subdural emphysema?
Subdural.
Or subdural?
Subcutaneous.
Subcutaneous
So that's something that we
emphysema.
palpate. What's something that you visually might see?
Jugular or tracheal distension or deviation.
Deviation.
Tracheal
Why might we see deviation?
Could
From a tension pneumothorax?
from a tension pneumothorax.
So
The
if I
pressure
had a
is
tension
like
pneumothorax on my right lung, it's deviating organs to the opposite side.
Oh, so
Right.
then it will deviate the...
the
Okay.
opposite way.
Opposite way
And
too.
it's causing a backup of blood flow, causing
The
jugular
jugular
vein
vein
distension.
distension.
Okay.
It's an example of what type of shock?
Hemorrhagic shock.
Obstructive.
Obstructive shock.
Obstructive.
It's obstructing the heart from doing its
Oh,
job.
All right. Head, neck.
And then...
That was it for neck, right? Yeah.
How do we palpate? And what are we palpating for? You said it earlier.
Subcutaneous
There you go. Keep
emphysema.
going. All right, subcutaneous emphysema, and then palpate. What do we palpate on the back of the neck?
On the back of the neck for spine.
Yeah.
Spine
Okay.
injuries, tenderness.
Okay. None of that is noted.
Okay.
Now, what do you want to do with your C collar?
Now we can put on the C collar.
So, how do you size up a C collar?
How do we size up a C collar? So I put my fingers onto Martina's neck
All right.
and then see that.
So, would you want your fingers? Have your fingers facing towards the front of the neck,
Okay, right here.
and you're saying how many fingers it takes to get from the top of Martina's shoulder
to the jaw.
to the chin,
To the chin, yeah.
and
4.
and Martina, you can scoot closer, Martina. And while you're doing that, so because I don't want you to float your hand, so keep
Okay.
your hand like on the shoulder.
Oh, okay.
And how many fingers does it take?
4.
Takes your 4?
Yeah, it takes
so
my
then take your 4, and where do you apply it to on the C collar?
On the C collar, it's right under this blue. It's right on this blue. So
Okay,
right on
and
the
then
bottom.
where should the red dot on the C collar go?
Where my fingers.
Which
sit
finger?
on the fourth.
Behind the top finger.
Or behind
Under
the
the
top fourth?
highest finger.
Under and okay. So this in this case it'll be the third.
Okay, so go ahead and place the red dot there. You
Okay,
gotta
unlock it
the
first.
buttons.
And then
Size
pull this
it
up.
up.
Oh. Okay. And
Relock it,
Relock it.
and then how do we
Maybe I'll
apply it
take
on
this.
Martina?
Do you want? And then
Let me take this off.
Good, I like that. I like that.
you start by putting it. Sorry. You start by putting it under.
Good. Get the Velcro.
The Velcro from behind.
Good. Long arms.
And
Good
then-
reach. Good. And then rotate this way, Martina. That looks good. That was great. You can take it off. Unless you want to keep it on. But
Do you
you
want to
can.
keep it on? Okay. Okay.
All right. So the C collar is applied. We're moving down to the chest.
All right.
To the chest. Decap, BTLS. Is there any bleeding? Any of those?
There
things you mentioned?
is no bleeding, but you notice pus-filled blisters to the right side of the chest.
Pus-filled blisters to the right side. Okay. And then what else is next?
And no chest sucking.
Like
wound.
what might you see on the chest?
No
And
chest
what are we
sucking
looking
holes.
for?
Oh, what is it called? Paradoxical movement.
Okay, so we're looking for equal chest rise and fall,
Yeah.
and along the same vein, paradoxical movement. You don't see paradoxical movement. What else might you see?
Emphysema.
Nope.
That. Oh, any
Any
What's that
sucking
called?
chest
What's
wounds?
that
sucking
called?
chest wounds?
Yeah, you don't see any.
Oh, okay.
All right.
All right, and then what's
How
his
do- and then
lung
how do we-
sounds?
Okay, good. Lung sounds are still wheezes bilaterally.
Still wheezes.
Wait, no,
bilaterally?
they're clear by now. They're
Okay,
clear.
Clear?
Yay.
Okay, that's good to hear. And then what else?
Well, how do we palpate?
For chest.
Or chest?
Um.
I'm not too sure.
Yeah.
So
How do we-
palpate from your shoulders,
Shoulders.
down your clavicles,
Okay.
down
And
the
then the
center of the
sternum,
sternum, and then the
then-
rib cage.
Oh, okay.
And what are you palpating for?
If there's any broken bones.
Okay.
Any fractures.
So noted by crepitus, tenderness, deformities. Okay.
Yes.
All right. None noted.
All right.
Okay. Are you guys keeping track of the burns that are present?
Yeah, so we have the face
All right.
appearing to be superficial first-degree burns because you
Okay.
said it was red.
All right.
Then we have the chest with the blistering, so it seems to be second-degree burns.
Is it on both
the right
sides?
side.
On the right
On
side.
the right side.
Okay. And now we're in the abdomen.
And now we are in the abdomen. So for the abdomen,
You notice pus-filled blisters across the abdomen.
all right, so
Okay.
more second-degrry burns to the abdomen. So
Yep.
we are going, is there any decap, BTLS, deformities, contusions, abrasions, bruising? Or,
No.
No. Cool. Then any bleeding in the abdomen?
Nope.
No bleeding.
What might you visually see?
Distension or
Distension.
swelling or...
What's it called? Eviscerations?
Oh, evisceration. That was nice.
No
So,
evisceration.
no organs hanging
No
out.
obvious injuries.
Okay. Are there any
You
bruises?
said-
Any
you
bruising
said-
to the
okay, so you
flanks
said
or the umbilical
distension,
around the umbilical?
discoloration. What would it look like if they're like this?
That would be
Guarding.
guarding.
Okay, there's no
Yes.
Oh, wait, I
guarding.
gotta move
Guarding.
my mic closer.
All right. And you said discoloration around specific areas. You
Yeah,
said
so
umbilicus and what?
in the flanks.
In the flanks. Okay, none noted.
None
What
noted.
about either listen or manual palpation? What do we do for those?
So you're gonna start with the least painful quadrant and then make your way around, but it's gonna be like hands on top of one another and gently press, and you're gonna be feeling for those things. So tenderness, distension.
Palpitations.
Yeah, exactly.
Okay. None noted. All right. So pulsating masses, rigidity, tenderness, rebound tenderness. None
Yes,
of that is noted.
All right, and that's it for abdomen.
Okay.
We can move on to the pelvis. So again, decap, BTLS, any obvious bleeding or
Nope,
anything.
Notable.
We are going to palpate by doing for the pelvis. You're going to push in and down and see if there's any difference between the
Any
pressure you
instability?
get, any instability. Yeah,
Nothing.
nothing.
Okay.
And there's one more thing for the pelvis, or no?
This person is
Oh,
a
if they
female.
had
Priapism.
Do they
Any
have
priapism?
All right. No problem.
No priapism. All right, that's it for pelvis. Now we can do the extremities. So the same for upper and lower, but we're going to check for decap, BTLS, any bleeding.
Yeah, you note swelling and charred leathery skin to the posterior side of the right leg.
Posterior?
Side of right leg. All right, so these are looking like third-degree burns. Yes, just stating that out there. All right. So for the extremities, you said no bleeding, but there is swelling and charred leather skin. PMS, so pulse motor sensory. We are going to see if they can feel, if they're able to give tension, so like squeeze my hand or put pressure with their feet. And we are also going to check for a pulse, so the radial or their pedal.
Very weak pedal pulse. Motor is tough, and sensation is tough.
Yeah.
Okay.
All right. Okay. And then we're going to palpate. So again, kind of trying to see if there's any broken bones, if we hear any, I'm blanking on the term now.
Crepitus?
Crepitus,
No,
yes,
none
thank
noted.
you.
On the legs?
On the legs and the arms.
Oh, the arms. No. None
Okay.
noted.
All right. Yeah, now would be the posterior.
Okay.
So to do that, we would probably use the help of a backboard or she is on the stretcher.
She's on the stretcher.
Yeah. We would gently rotate her
Log roll.
Log roll,
Okay,
thank
so
you.
log roll.
And then the person that's usually closer to the shoulder and the upper body will palpate and
What
feel.
are you looking for?
We are going to look for any sucking chest wounds,
Not present.
any bleeding.
Nope.
If we can feel any decap, BTLS, so any deformities, contusions, abrasions.
No. What else?
I'm blanking.
Tenderness?
No. No tenderness. Well, spine is tender,
Yeah,
but
spine is
you're
tender.
blanking on something you're palpating. Okay.
Subcutaneous emphysema.
Subcutaneous emphysema is also absent.
Absent.
Alright.
Right. Okay. So I think we've done a complete head to toe.
Okay.
We have realized that the layers of the burns that she has. So I think the most. Okay, so we could definitely say it's over 10% of
It's
her
always over
body,
10%, yes.
which means at this point we are going to use dry. Bandages.
Okay.
And yeah, I think we would focus on the 2nd and 3rd degree burns, mainly the 3rd degree burns, and we would just wrap them, right? Am I blinking?
Yeah, wrap them with dry.
With dry
sterile
gauze,
dressing.
sterile, yeah.
Okay.
Yeah. I'm trying to think. Was there anything else?
Yeah, dry. And then anything you want in the secondary?
Well, we can. In the secondary.
You would do what? Ample, opicurus.
Oh, yes.
Oh,
yeah.
Vitals.
We're still thinking about
I
what
was
to do
gonna
with
say
burns.
vitals and stuff, right? So at this point, we would transport, and then we can continue the ample and OPQRT on the ambulance. So yeah, maybe while you ask the questions, I would be getting vitals. So just real quick, like blood pressure.
78 over 40.
78 over 40, so that's pretty low. Heart rate.
122.
Breath rate, reading rate.
4.
SpO2 now after the
96.
Okay, great. And has the wheezing and stridor diminished or?
Yeah, they're clear.
Great.
Pupils?
Pupils, yes, thank you.
Pupils are plural.
Okay.
Great. And in theory, yeah, while I was doing that,
Then we can continue with the
asking
OPQRST. So were your symptoms sudden with the burns, or were your symptoms? How do I describe this?
Yeah.
I just felt like burnt to a crisp.
Burnt to a crisp. Okay. And then would you say that? And then how would you describe that pain radiating toward your body?
Oh, it's everywhere.
Everywhere?
I feel like I'm on fire.
Okay. So no position helps with the pain? No? Okay. And then how would you describe these burns? Like, how do they feel?
Worst pain of my life.
Worst pain of your life? And then if you had to rate your pain on a scale of 1 to 10, 10 being the most painful, how would you rate your pain?
A 12.
A 12? And then how long would you say you had these burns for?
20 minutes.
20 minutes?
All right, then we can do ample. So any allergies?
No allergies.
Any medications?
Albuterol.
Any important medical history?
Asthma.
When's the last time you took any or ate anything, take any medications?
A few hours ago.
Okay.
Just coffee and hash browns.
And you were saying that you were just in your living room, then you saw smoke, and you went to go get your cat, and next thing you know,
the living room was on fire. I was looking for my cat, and then the building collapsed.
All right. We would be checking vitals every 5 minutes for this patient. This could be a multi-trauma scenario, but yeah, we would keep an eye on. We would reassess every 5 minutes. Yeah, is my point.
Okay.
But I don't think we're missing anything else.
We're missing anything either because we are already on transport.
Right.
Okay.
So if the radio call would be the next thing.
Go for it.
So we were dispatched, or Northwestern, this is ambulance 1. We were dispatched to a house fire and to a multi-patient scene. We had a patient who had burns over majority of her body. We noticed she had wheezing and stridor with an SpO2 of 89%, so we applied a neb kit with 2.5 milligrams of albuterol and 0.5 milligrams of Atrovent. We initiated shock treatment and did a full head-to-toe assessment. Saw first-degree burns to the face and neck, second-degree burns to the right chest and abdomen, and third-degree burns to the arms or to the right posterior leg. That was all Yes. And we are now her SpO2 is 96%. Wheezing and stridor have been diminished. Patient is, we are 10 minutes out. Any questions?
No.
All right.
Very good. Any questions?
I probably could have added the vitals for the radio call, but that's fine.
What were the pupils?
Pupils were pearl, or I didn't write it.
What was
Yeah.
blood sugar?
Blood sugar we did not take.
We did not take.
62.
62.
62.
Oh, okay. Let's finish strong.
All right. So, yeah. Let's see. I had a question, but I forgot now. That's fine.
I mean, I liked how you chose dry dressing over moist dressing.
Yeah.
It's it would be a lot easier to do in person. A lot more traumatic looking, but I think just a lot of traumas visually driven.
Yeah, I think that's more my question, like the flow of things. Obviously, you want to treat what you see,
go because
but at
it's
the
visual.
same time,
And not everything. Most things could be treated as you see if they're considered life threats. If they're not life threats, then they're considered distracting injuries.
Yeah.
Okay.
So like the stridor and wheezing, we did that right away. But the burns, we obviously didn't know if there were other things that were of higher
They're just signs.
degree. Yeah. Okay.